CAP and its allies score wins at the AMA annual meeting. Medicare reimbursement reform gains momentum. And the case of an abdominal disease hiding behind other symptoms. These stories and more coming up next. This is Path News Network Daily Edition from the College of American Pathologists. I'm Nick Lonnie. It's Tuesday, June 16th. Pathologists scored important wins at the American Medical Association's annual meeting in Chicago last week. The AMA adopted a CAP-sponsored measure calling on Congress to improve the local coverage determination process, which is badly needed to address undercompensation for pathology services. The CAP was also able to influence a new AMA policy that supports standardized oversight and transparency for toxicology laboratories that are exempt from CLIA, for example, labs that perform drug tests for law enforcement rather than treatment. As always, the CAP worked with its allies in the Pathology Section Council, which also includes the American Society of Clinical Pathology, American Society of Cytopathology, American Society of Dermatopathology, and the National Association of Medical Examiners. Dr. Mark Sinovec, president of Kansas-based Topeka Pathology Group and head of the CAP's delegation to the AMA meeting, told us that this collaborative approach was essential to a victory in another key area.
Actually, all the member societies got together and provided a resolution to the House that was accepted as written. And what it did is created policy that the AMA actually now recognizes the unique and critical role that medical laboratory professionals have in patient care and public health. And the idea that we really have an urgent need to address workforce shortages. Specifically, we also asked the AMA to collaborate with relevant stakeholders, including our societies, accredited bodies, to really see what we can do to work towards solving the current workforce shortages.
Dr. Sinovec also urged CAP members to join the AMA if they haven't already. The CAP currently has 4 representatives in the AMA House of Delegates. That number would rise to 5 if fewer than 400 additional CAP members joined the AMA, which recently reduced its dues to encourage more members.
The more AMA members we have that are CAP members, the stronger our voice is, and there's power in numbers, obviously. So I strongly encourage every CAP member to become an AMA member as well.
Legislation supported by the CAP that would reform Medicare's payment system for clinical laboratories reached a key milestone. It now has more than 100 bipartisan co-sponsors in Congress. The so-called Results Act, which stands for Reforming and Enhancing Sustainable Updates to Laboratory Testing Services, would require the Centers for Medicare and Medicaid Services to obtain accurate information about commercial payer rates for clinical laboratory services from an independent third-party database. It would replace the current inaccurate system that would cut lab reimbursement rates drastically if left unchanged. The CAP asks all members to contact their representatives in Congress to support the Results Act. A case study recently published by ResearchGate told the story of a 45-year-old woman who seemed to have a common gastrointestinal disorder. Her symptoms included stomach pain, chronic diarrhea, weight loss, and aching joints. Blood tests were unremarkable, and an ultrasound revealed gallstones. But doctors kept looking, and they found several signs of infection. An endoscopy found pale yellow and white shaggy mucus in her duodenum, and duodenal biopsies using PAS-AFB staining found PAS-positive foamy macrophages. Tissue samples from lymph nodes found PAS-positive infiltration. Sure enough, both tissues tested positive for Trophorema willipi, the bacteria that causes Whipple disease, a rare infection that damages the small intestine and causes a variety of symptoms, including joint pain. The woman was treated with antibiotics and her symptoms soon faded. The authors concluded that Whipple disease should be considered in patients with chronic diarrhea, weight loss, and joint pain, even when other diagnoses, such as gallstones, are found. And finally, You can learn more about laboratory management at a free webinar next week on Enhancing Laboratory Management Operations Globally. The webinar is the second in a three-part series sponsored by the CAP Foundation's Global Pathology Committee. This session will focus on planning and executing new test systems and developing successful teams. It will include a live Q&A session with the presenters. It's scheduled for 1 week from today, Tuesday, June 23rd, from noon to 1 p.m. Central Time. To learn more and register, go to the CAP Foundation website, foundation.cap.org. That's all for today. See the show notes for more information on today's stories. And if you've got a story to share, write us at stories@cap.org. We'll be back Wednesday at 5 a.m. Eastern for another episode of the Daily Edition. I'm Nick Lonnie. Have a wonderful day.